Everybody, this is Dr. Kamel again, and a new content related to the physical therapy license exams and also to the physical therapy education. If you didn't see any of my videos before, my name is Dr. Kamel. I am as working as associate professor of physical therapy in United States, and I'm a licensed physical therapist in United States, in the UK and Egypt as well. I got my PhD from University of Nottingham in the UK. So let's go straight to our today's topic. Today's topic actually is about research. Okay, and some people they said, okay, how about research and statistics? What is the benefit? Research and statistics will be in your undergraduate study, postgraduate study if you are planning to apply and take DBT, in if you are applying to do postgraduate research or anything of even in clinical settings, you will be in need to use and understand research and statistics. So let's see what's today's question. Which of the following reasons is the primary purpose for applying this statistical analysis to a single subject research? We know as a single subject research is one of the weakest research types, and it is on the bottom of the research pyramid or the research study list. We know that randomized control trials, systematic review of randomized control trial is a most strong one, and so on. But this is not our discussion today. Here they are asking you, what is the primary purpose for applying a statistical analysis to single subject research? Okay, to substantiate visual analysis of graphically displayed data, maybe to determine whether observed changes are real or chance occurrences. I'm not sure if this is correct. To advocate changes in intervention methods, I don't think so. To establish credibility for the intervention technique, I don't think so also. So the correct answer is to substantiate or visual analysis of graphically displayed data in a single subject or single case. Sometimes we call it case study research. The primary method of interpretation is visual analysis of graphic data. We might look at the level, trend, variability, immediacy of effect, overlap, consistency. And this statistical analysis, when we use it, are a secondary thing, and mainly is applied to support or confirm what we already have seen visually. Okay, increase the confidence in conclusion drawn from these graphs. So when we putting any comments, we are confident that they are true and these conclusions are true. Help when visual interpretation is ambiguous, not clear, and they are not the primary decision making tool for sure. Okay, so data analysis in a single subject research is based on evaluation of measurements within and across design phases to determine if the behavior, we mean the behavior of the subject or the case we are studying, are changing, and if observed changes during intervention are associated with the onset of treatment. So does treatment change the behavior of the subject or this case study? So while visual analysis of graphic display of data is the most commonly used data analysis method in single subject design, a statistical analysis is just a quantitative approach or a secondary approach to determine whether these observed changes, which we have seen visually, on or represented graphically are real or it is due to chance. Okay, so we have seen some changes in behavior, in pain level, or whatever in the case we are studying. And it was graphically represented, okay? And we need to make sure is our interpretation of this graphic representation is true or not true. So we do a statistical analysis in order to make sure that our interpretation of these visual findings are correct. How about the incorrect options? To determine whether observation are real or chance occurrence? No, this is a primary purpose in group-based research. We cannot get this data or make this conclusion from a single subject research. Single subject design only, replication, visual pattern, and not probability testing. We cannot assume or guess any information depending on a single subject study. Number three, to advocate changes in intervention methods. Usually, clinical decisions are based on outcomes, clinical reasoning, and not on a statistical analysis. To be honest, you know, to establish credibility for the intervention technique, credibility, if we say that something is credible, come from replication across different subjects, different settings, and not only statistics. Okay, if we say that this intervention or this machine is credible and can be used, how we can do that? By using the machine or the intervention across different subjects, different settings, not from just applying a statistical analysis alone. If you would like to join my course, and I want to explain that this license exam preparation course have changed the mind and the knowledge of many physical therapists who have taken this course with me. Some of them, and I have their comments that the course helped them to understand more clinically, think more logic and more scientifically regarding their patients and clinical practice. So it is not only for exam license preparation. We have the scope of the course is beyond that. So, or if you want also to apply and join the transitional DBT program at University of Montana, which we, help people to join this degree at a discounted rate, please drop me a message on either WhatsApp number 001442248720 or 00201027743702, and I will give you all the details required and we can go from there. Thank you so much for following and watching me. Please subscribe to the channel and tell other PT physical therapists and other PT students about the channel. Thank you.